that for us this is a must-attend event, and I think that's reinforced by the number of colleagues who've joined us this morning. Let me just give you some of the results of the numbers and the research and the tracking that ICN have been doing since February or March through our national nursing associations. Everything that I'm going to say very briefly, it'll be a whistle-stop tour, is available on our website. We've been tracking infection rates amongst nurses and healthcare workers from the get-go of the pandemic. There is great variation, but we think it looks like somewhere between 10 and 14%. You work out what that is in terms of the total number of COVID infections. This is a huge number. It is undoubtedly related to lack of PPE, faulty and inadequate PPE. We think there's been peaks and troughs as PPE has improved, but with these second surges, those rates are still very high. Tragically, 1,500 nurses we know have died in 44 countries. The true number will be higher. But this is data that ICN is collecting because there is no standardized and systematic collection globally, and we've been calling for this since February or March. I was delighted to see WHO reinforce the need for that data just a week or so ago, but I think we're very, very late in terms of having it. Not the data for data's sake, but it would improve and help our learning to protect our nurses. Our NNA survey has showed the level of abuse and violence, 70% being reported by our NNAs of abuse and violence. No one's going to condone that, of course, but if nurses are not being protected with PPE, then quickly people become fearful that nurses or other health workers are vectors of disease. That creates enormous mental health distress and psychological pressures on nurses, yet still we think only half of countries are formally recognising COVID as an occupational disease. So it's not just the physical, but it's the emotional and the mental health burden that nurses are under. Helen, you've already said there's a massive shortage. 6 million we went into this pandemic with. That's 22% of the nursing workforce. In many ways, nursing shortages is emblematic of the lack of preparedness of our health systems for a pandemic. Are we now seeing the massive increase in education, in nursing education, that the State of the World's Nursing called for? Not as yet. I know it's early days, but we have said to governments just in the last few weeks, look, we've got this huge shortage in nursing. At the same time, we're seeing sectors of our economies losing jobs in retail, hospitality, for example. Why aren't we creating and using funding to allow people losing jobs in some part of their sectors to move into healthcare? That's not about dumbing down standards at all, but I think there is genuinely an opportunity to put health at the centre of economic recovery and health workforce at the centre. But it's not just about recruiting people, it's about retaining who we've got. We put out a report just last week on older nurses. That 6 million shortage, I have to tell you, it's actually worse than that. 1 in 6 nurses are due to retire in the next 10 years. Factor that in, we're talking about a shortage over the coming years of 10 million nurses that we need to recruit or we need to hold on to. And we worry that it actually could be more than that, because we are hearing nurses saying, look, because of what I've been through with COVID, I'm going to quit once this is over. I'm not going to stay as long as I intended to. I have to tell you that we are picking up a mood change around the world. You're going to hear from Zimbabwe as one example, but there's a number of countries I've heard from where nurses are protesting, where there's strike action, where there's real challenges with the working conditions and pay issues as well, where nurses are wanting to see action and wanting to see support, and governments are not following through on that. The other dynamic to flag is migration, international migration. There's another report that we've put out. Of course, the lack of travel has stopped that, but the shortages we're seeing in some countries, we're hearing countries talking about, once travel's allowed, they will go to other countries to recruit from to fill their own shortages. We've got a report on all of that as well, because it really could exacerbate the inequalities we've got in the numbers of nurses, the distribution of nurses around the world. But I just want to finish, though, with some really positive, I think, messages, because I think at the same time we see nurses with the solutions, leading the public health, the promotion, the prevention effort. All of the non-COVID non-communicable diseases, the non-COVID health needs that people still have. Nurses are in a fantastic position to lead those models of care. Think what's going to happen with the vaccines. People are going to be, they're going to get the jab and they're going to have to sit there for 15 minutes to make sure there's no adverse reaction. And the nurses who are at the forefront of administering the jab will be talking to them about their other healthcare needs. They'll be picking up those healthcare needs as well. So if we really get behind our nurses, they are the solution to many of the challenges we're facing. But to deliver on that, we need leadership, not just internationally, but in countries, in their governments, in their health systems, in their health providers. We could do much more to make sure that nursing voices are influencing political and policy decisions. And I would not like to, I think that one of the often underrated, under-recognised organisations who are providing phenomenal leadership are our national nursing associations. They've really stepped to the fore, not just in terms of the policy issues, but often our associations are providing things like mental health support as well. So we need to include and incorporate them more. And there, I think, is a message of hope for what we need to do for the future as well. Marion, thank you. Back to you.
Thank you so much, Howard. That was excellent. Adding the research part of it, you know, if you have evidence, it's very wonderful to back up all of the statements. So thank you very much. And the whole idea of not only lifting the shortage, but talking about the retention and nurses being part of the solution is just marvelous. Thank you. And now, we also actually, even we thank you for your presentation last week on the support, especially to older nurses at work. So we're excited about that. Thank you very much. Next, I would like to invite Barbara Stilwell to share her thoughts. Barbara, welcome.
Thank you so much, Marion, and greetings to all of you wherever you're watching today. Let me just start by saying a big thank you to all you nurses out there. You've been amazing. We're an organisation, Nursing Now, of which I'm the executive director. We're an organisation made up of nurses around the world who voluntarily interact with us. We know it's been very tough this last year. So thank you to all of you who have stepped up, stuck it out, hung in there, are still there. This has, as our previous speakers have said, been a year like no other. I doubt that we really could have highlighted nursing in any greater way than has happened this year. Of course, we didn't mean to do it like this, but this is the way it's happened. I echo very much what Howard and Annette have been saying. What I want to add to this and reinforce something Howard said is that because we're a social movement, we see that the mood in nursing is changing around the world. We're actually active in 127 countries. We're not a formal research organisation, and we, haven't got money to be doing research, but we have been listening to what nurses have been saying and responding to what they've been saying. There is a mood change. Nurses are beginning to want to speak out more than they have done in the past. And thank goodness we have a strong ICN that's going to harness those voices. Here's 3 things that we've noticed in Nursing Now, and perhaps I hope they'll resonate with you. Things that we need to address going forward. The first is, you've heard this before, nurses are really good at talking to each other. We have meetings where we tell each other really interesting things, but the problem with that is other health professionals, policymakers, don't hear about our evidence. So we need to be getting much better at having our voices heard. And one thing we've noticed during the pandemic is when there are policy statements from the Minister of Health, you may get the Minister of Health, the Prime Minister, the Chief Medical Officer. Where's the Chief Nursing Officer in all this? Why is the Chief Nursing Officer not standing at the podium giving a perspective on all of these things that nurses know about looking after people? particularly during a pandemic, nurses are there at every step of the way, from testing, through diagnosis, through treatment, sadly through palliative care, end-of-life care, caring for relatives, and prevention. Nurses are there doing at every step in that care chain. Where are they at the policy level? We're saying they need to be integral to policy making, not just during this pandemic, but going forward. Because we can see now that for effective response, we need a nursing voice. I just want to pick up also on the shortages, the second point. This year we've had State of the World's Nursing. It's evidence, it's data. We all need to be familiar with it, taking it to our own ministries and saying, here's how you invest in nursing in my country. And one of those investments, I would contend, has to be advanced nursing practice. We need to look very closely at where nurses can lead on care, where they can provide care independently, where they can be the team lead. And that may not be the places that's happened in the past. That may be different going forward. The third and perhaps the most important thing Howard alluded to with some of the stigma that nurses have faced, some of the cruel, unkind treatment that sometimes nurses have had. What we've learned is that mental health of nurses is going to be really paramount moving forward. We've been asked to run sessions on self-compassion. What we've learned is that there's really no substitute for support and supervision and kindness in making the workplace a decent place to work. That's a really strong lesson that we can move forward with as we move into rebuilding our workforce. Thank you, Mariam. Back to you.
Thank you very much. Thank you. That was excellent. We're very happy for your remarks. You know, I have my old nursing now. My old thing has been on my iPad for a very long time.
Fantastic.
I'm very proud to be part of this panel with all of you on it. So it's very exciting. And I'm sure that our participants and other panelists are learning a lot as we go. You know, that's what's happening when you get nurses together. We talk about, we're good at talking to others. We need to know how to share it so that others will listen. Nurse practice, but I especially like the emphasis that we put on mental health, and nothing can replace kindness. Thank you very much, Barbara. That was excellent. As we thank all of our panelists, Honorable Clark, Barbara, Annette, Howard, we are very pleased. Now we want to hear from you, the participants. We know that many of you are ready and would really like to speak. But let me say that we will really want to hear from as many of you as possible. So as we open the floor, we want for participants to please try, like we say, practice the KISS principle. Keep it short and sweet. I will gently be enforcing that to ask you to please talk for not more than 2 minutes. I want to take this opportunity. You can also contribute to the independent panel directly to the survey link that we have available. If on the website, you go there and you can click on your contribution, and you will be able to continue to contribute. So now the floor is open. When you are invited to speak, kindly open your own microphone and video camera. We understand that we are now ready. We have speakers. First, we would like to call the president of the Korean Nurses Association, Dr. Lin Kim.
Thank you very much, Marion. Good morning, good afternoon, and good evening, everyone. It seems that the global community has been in the middle of political, economic, and social changes since the outbreak of coronavirus about 10 months ago. The Republic of Korea had experienced SARS, swine flu, and MERS at 5-year interval before coronavirus, which led us to establish a strong national health security crisis response system against infectious disease. Recently, our government has raised the status of Korea Centers for Disease Control and Prevention to a vice minister level agency in order to strengthen the management of infectious disease. In particular, in early February, when the new disease broke out, the government led the development of the coronavirus test kit, which was widely used nationwide and other countries. In addition, we have introduced the world's first drive-through test centers to protect health workers from the infection. For mild and asymptomatic cases, we have designated and operated residential treatment centers using private sector. In addition, epidemiological investigation teams consist of nurses and other staffs were formed at the public health centers, each city across the country, and they played a major role in preventing the spread of coronavirus. The Korean Nurses Association has recruited and dispatched nurses. In March, we had recruited about 3,900 nurses who were retired or on leave. In December this month, we started a second round of recruitment. Now the number has amounted to 2,000 in 5 days. It deserves to be recorded as an important event that shows the commitment of Korean nurses amid the national crisis. The Korean Nurses Association has developed training program for nurses in intensive care to foster skilled nurses and distributed the guideline titled Safe Nursing Guidelines in the Pandemic Era for nurses across the country to ensure their safety. The year 2020 has been designated as the Year of Nurse and Midwife, in which nurses and midwives from all over the world joined to fight against the disease. The new pandemic clearly shows that we need to unite and respond globally, as it is not a single country's task. I am glad to listen to the experiences from other countries and learn from them through this meaningful opportunity. Let us overcome these difficult times with strong solidarity and compassion for each other. Thank you.
Thank you very much from the Korean Nurses Association. We'll now call on the Ghana Nurse and Midwifery, Perpetual Ofori Amufu.
Yes. Thank you very much. I bring you greetings from the National Council of the Ghana Registered Nurses and Midwives Association. Indeed, we are very much grateful to God for this opportunity, because throughout this pandemic, a lot of people have lost their lives, but we are here and we have this opportunity to discuss lessons that we have learned through this pandemic. I must say that the government of Ghana's response from the 12th of March 2020 actually helped us to curtail the spread of the infection, when at that time we had the two first cases which were actually imported from overseas. So the government's intervention of closing the borders and also banning social gathering curtailed the spread. As at today, we have in total 53,270 confirmed cases, out of which 51,965 have recovered. Active cases are 978. And in total, in terms of deaths, we have 327. On the National Nursing Association front, that is amongst our nursing and midwifery fraternity, as at 28th July 2020, we had 840 of our nurses and midwives who were infected with the virus. And we had 2 deaths as at 28th of July. But as at today, we have 3 deaths. So it's been a big issue throughout this year, since March till today, although the stress of the pandemic is gradually going down. As part of our response as an NNA, we issued 2 press releases during the beginning of March to draw government's attention to prepare, looking at the way the infection was spreading, to prepare towards us having such cases in Ghana. And we were fortunate to also be invited to the seat of governance by His Excellency the President in a stakeholder consultation to understand the pandemic and its related issues from the perspective of us as professionals. We used the opportunity to put across a number of issues, and key amongst them was the fact that we did not have enough PPEs to work with, and that was exposing our nurses and midwives to the risk of the infection, and also the fact that our health systems were not adequately prepared for the pandemic and all that. And following that, we had to write a number of letters to ensure that we get our voices to the Ministry of Health and to government about the need to provide the necessary logistics for us to work with. We took it upon ourselves to visit facilities which had been earmarked as treatment centers, and we interacted with the nurses and midwives. It was interesting to note that although they were there and ready to work, they were also having a lot of fears, considering the fact that we all did not know much about the virus and how to deal with it, except for what we knew about the need for personal hygiene and the need to protect ourselves, wear the necessary equipment and all that. So those interactions were very meaningful to us. It made us understand that we needed to do more as an NNA. So we took it upon ourselves to have a Facebook Live interaction with the general membership. We brought on board a psychologist, we brought on board a reverend minister, and some representatives of the quadrant were also there, and we were able to interact with members. They asked a lot of questions, they expressed their fears and their sentiments about the lack of or the unavailability of the PPEs to work with and all that. It was a good interaction. And following that, we were able to also identify those who themselves as nurses and midwives were in isolation and under quarantine and needed some psychological support. We had psychologists who were able to engage with them one-on-one to assist them to go through those difficult times. We also procured some hand sanitizers, about 24,000 pieces of that, and shared it across our regional constituents to be sent to some facilities to assist our nurses and midwives. We also visited the National Treatment Center, which is Ga East, and visited Rage and other places to interact with the nurses who were there and working. And we were fortunate to also have been called. I, as the president, was called upon to serve on the National Technical COVID-19 Committee and also the Commodities Committee. And Ghana took it upon itself to produce or develop some of the PPEs locally, and the Commodities Committee with other professionals, we helped to facilitate that. The National Technical COVID-19 Committee, which was supposed to serve as the overall committee, for me, in the beginning, I did not see what I was expecting, that they would take that bold step and be out there and doing what was needed to be done. I realized that it was more of the emergency committee and the case committees that were actually on the ground doing the work. And we called on government to allow us to sit on those committees, to also share our views as nurses and midwives on those committees. It became a tussle back and forth. We did not have that opportunity. But in all this, we have learned a lot, in the sense that there's need for more investment in public health services. They need to strengthen the general public services, including electricity, water, and others, and also to actually stop the campaign of privatization, because looking at this whole pandemic, it's been about public services. And we as an NNA have realized that we can also reach a lot of our members in terms of education, soliciting for information, and sharing information through virtual means. Thank you very much.
Thank you very much. Thank you very much from Ghana. And we go to our next presenter. We're asking people to kindly do for 2 minutes so that we'll be able to hear from people. So we have President of the Indian Nursing Council. Yeah.
Good morning, good afternoon, and good evening. Greetings from the Indian Nursing Council. We also had a similar experiences, like some of the challenges which our nursing professionals, nursing and midwifery professionals faced during this COVID-19. Like, for example, that ensuring the adequate PPE is one of the big challenge we faced, and also the discrimination which prevailed during quarantine period between the nurses and other medical fraternity. That was a big the discrimination which was observed, and sporadic strikes are also were held by the nursing professionals, because in India about 75% of the healthcare delivery system is under the private sector, and 25% of the healthcare system is under the public sector. So there is a big gap, the way the nurses have been treated in the corporate sector hospitals and the small nursing homes. There was a big the discrimination. So that was one of the, and especially after having a PPE, making the nurses to work long hours, because the nurses has to express that it will be difficult to work for 12 hours. They were all requesting for to reduce the duty hours. And also the recruitment, because shortage of the nurses, because the investment. See, I think this International Year of the Nursing report, which is very clearly as saying investment, creating the nursing positions is one of the big challenge, because we are not having a optimum nurse-patient ratio. With the result, even though nurses are available in the market, the private sector and also the government sector, they are not able to invest more money for creating the jobs. That is one of the big challenge. Hopefully this International Year of the Nursing report recommendation, which the government of India will be able to address these issues. And many of the instances, some of the nurses have to be away from the family, and especially there are some visuals which we shared to the ICN. A nurse with a 2-year child has to be away from the 3-year-old child, and away for the 1 month, not seeing their family members due to the quarantine and all those issues. So the burnout was one of the, very clearly we were seeing, we had a lot of 24/7 telephone updates for the nursing in the mental health issues. We saw that, but fortunately, Government of India's support was coming in a big way, because the Prime Minister of India was first had a dialogue with all the healthcare professionals, including the nursing professionals, and he was able to speak to the nurses who are taking care of the COVID-19 patient and telephonically. So that is the support on which we were getting from the highest functionary of the Government of India. That motivated many of the state chief ministers to interact and to support the nursing professional at the state level. And very important, 2 regulations have been announced by the Government of India, which was, one is zero tolerance. So the ordinance the law was enacted that the healthcare professionals are protected in case of the some violence takes place by the public against the healthcare professionals. That is one of the law was enacted. And also the loss of the nurses and the healthcare functionaries losing their life. A 75,000 worth of a insurance scheme, $75,000 worth of a insurance scheme was announced. So these are the two big ticket announcements were done by the government of India, and also giving the instruction to all the states to ensure proper safety of the nursing professionals. And also in the case of the
Thank you very much. Thank you very much, sir.
I think the one thing I would like to point out that we need the nurses in the policy table, because though they say it will be a lip sympathy, I think all the nurses working at the national level, state level, and at the institutional level, having them in the policy table with empowered, but not having physically having a person, but they need to be empowered. I think that is the one. Hopefully, the International Nurse Report soon has recommended these things. I think WHO and ICN has to take forward these things at the country level, and NNS will be working for that. Thank you very much.
Thank you very much. From India, we're very happy. And now we go to Italy to hear from Florinino Pinto. Welcome. Thank you very much.
Thank you. Hi to everyone, I'm Floriana and I'm an ICU nurse, and in this year I've been working as a COVID ICU nurse in Milan. For me, the key word about Italian nurses responding to COVID ICU pandemic is competencies, because in this pandemic we are showing in every context we work organizational, relational and clinical skills. COVID-19 is making us living so strong experience about emotional and human fragility and also clinical complexity of this disease that we have to bring out our best, even if we are not working in the best condition or we were psychologically exhausted. So we built new COVID ICU, we built new wards and start from zero, mixing working groups and having new colleagues that maybe had less experience or no one. So we had to find them to know each other, learn to work together and teach them what they need. We had to improve and change our relational framework to stay close to this patient and try to maintain the link between them and their families, even in that moments. So we work together and act as a group to adapt and create new protocols. Everyone took his part in this battle, and we put at patient service the unique mix of competencies, scientific knowledge, and inventiveness that only nurses have. So what I think that the key lesson for nurses, Italian nurses for the future, are, first of all, that we do need to act as a group together. Leadership in the proper meaning to be able to influence positively and change situation. Nurses in Italy are not enough aware of this power, and every nurse in this pandemic did act as a leader in each context, from hospital to territory. It's crucial that COVID-19 experience helps nurses themselves, scientific community, and people to know and recognize these unique skills we have to improve people's health. In Italy, nurses must start to sit and take part at the institutional table and have choices in health policies. It's a matter of leadership, because if nurses are well equipped, the more they will keep leadership roles, the more they can change the misconceptions surrounding their profession. And last of all, the key lesson, an important key lesson for the future, is investment. Investment in Italy from institutions and learning from past errors made in the first wave. Investment in terms of human resources, proper staffing level and better salaries. Investment in research, education and training based on European standards. Investment in building and recognition of human nursing advanced practice. I think that it's not a casualty that in those countries with lower staffing levels, we had higher death rates in this pandemic. worse patient outcome and collapsing healthcare system. I think, as the Nursing Now campaign saying, that investment in nursing is an investment in everyone's health and the possibility to avoid that something like this could happen again in the future for another pandemic, pathology, or chronic disease. Thank you, everyone.
Thank you very much. Thank you very much. We now call upon Eileen Salgado, nurse from Mexico, for 2 minutes or less, please.
Thank you so much. Good morning to all the participants of this webinar. On behalf of the National College of Nurses, AC Mexico, we appreciate the opportunity to be able to share with the world the experience that the frontline personnel in the battle against COVID-19 have. I want to share with you that in Mexico, the Ministry of Health has officially reported more than 1 million confirmed cases and more than 130,000 deaths. This is not an official information so firm, because we have persons that we are not having the information out of the hospitals and in their homes. I'd like to share with you that I have witnessed of the lack of drugs which are not found anywhere in the country. There is a very serious problem here in Mexico because some of these important drugs are used to sedate patients who is requiring ventilator support mechanical. I've seen patients with a tube in the tracheal tube, desperate for not being able to breathe, aware of everything that happens around them. This is not a